Hello everyone, you are all welcome to lecture number 1170, and today's lecture is in continuation on allergic treatment, and today's topic is treatment of allergic condition in adult onset. Previously I already discussed about the natural treatment of children's allergic condition, but in the case of adults, there are some modification, and we go for some synthetic products also, which are very important. Mainly, they are all different type of vaccines and antihistamine. The histamine protein which is produced during this antibody antigen reaction, swelling, and lot of other conditions. And again I am just revising it, that allergy means your overreaction to some of the substances in environment, and for the same substances maybe surrounding your area or environment, living thousands of people are there, they may not be overreactive, maybe few of you, and that condition, overreaction, may cause lot of injury to your health, to your skin, to your eye, to any part of the body, because of the fighting of your body immune system cell, and that immune system cell is called antibodies, and antibodies are nothing but that is immunoglobulin E. Immunoglobulin E is the real force, a real protein that they are capable of recognizing and attacking the foreign substances which are coming to you, and they are showing overreaction. And in this overreaction, there are different types. For example, number one, that is called drug allergy. So with age, when I am talking of drug allergy, with age we are losing so many things. What are those so many things? We are losing our hair, we are losing our height, we are losing our innocent look, and at the same time, some of the allergic antibiotic drugs, they are departing from our age once we are aged. For example, penicillin, the most common known drug of allergic condition in childhood. Once we become more than 50-year-old, this penicillin allergy will disappear, because once you are aging, your immune system is more strong and capable and experience all those your immunoglobulin protein that we call antibodies. They are more experienced in networking to destroy. So that is one thing. The second is, that is we as adult, because we are consuming more tree nut, that is called dry nut in Indian subcontinent. Commonly it is called tree nut, because all the nuts which are grown on the tree, like cashew nut, like this almond, walnut, and that is pistachio is also a nut. So there are variety of nuts. Some of them even I may not be knowing, because they are all in other countries, different type of nuts, they are grown on tree. Also in Western countries, adults are allergic to peanut. peanut, some we call them groundnut. In India, we call it mungfali. So these allergies, what we are getting from all these vegetable product, they are all vegetable product, and it is nothing but their protein. And the protein what we are getting from these tree nuts, they will go and bind to with our antibodies protein. Let me make it very clear. Whatever overreaction, reaction, fighting is all the game of protein. Protein from outside and protein inside. So the ultimate and the full recovery as per today's science, medicine and chemistry of protein. And if you remember, I mentioned in the beginning that up to 2010, only two structures were discussed. When we are discussing a protein, of course some stereochemistry, but mainly two structures. Primary structure of protein, secondary structure of protein. And today, where artificial intelligence application is in action, and Google is claiming they have almost more than 160 million proposed structures. It is there in their library. Can you imagine? So in future, as a chemist, I am very much confident that all these diseases, they are all related to protein structure, will be over. And I am hopeful that very strong protein will be synthesized. H antigen, for example. And H antigen will be capable of clearing all A, B, C, D, E, F type of protein to show the reaction. And in my previous lecture, I have already mentioned that this year's 2023 Nobel Prize has gone on protein, mRNA vaccine. And that mRNA is nothing but protein. And those proteins which are present in our internal body, I have already told you that we have two portions in our body, health. One is external, other one is inside, that is called internal. So internal health is taken care by antibodies, type of protein, and that protein is called immunoglobulin E. If you go and Google, you will get a lot of detail. Here I am not going to discuss deep inside medicinal chemistry. So that is the condition where these fruits, vegetables, nuts, their protein, either they bind, or if you are taking fruit and vegetable like apple or watermelon, so many, they will be having traces of pollen. And those pollen, because flowering is there and fruit is there, so it will be there. So they may cause, that is called oral allergy in adult. Oral allergy means once you have taken something, some fruit or some nut, it happens to me. Whenever I will take any walnut, akhrot, or kaju, that is cashew nut, I will get some burning to the corner of my lip, and lip will become dry. In some cases, it will go up to that extent that when they are taking such type of fruit, vegetable or tree nuts, their lip will be swelling. They will get inflammation inside mouth, outside mouth, around their lip, and that reaction will be there. So with that reaction, itching and burning of the lip. But the very interesting thing is that it is only limited up to mouth, because the same allergens, once they reach to our stomach is so acidic that they are all neutralized, hydrolyzed into amino acid. So their effect is over. And that oral energy may continue for 30 minutes or 1 hour. The moment you stop eating that thing, it will go. So that is the thing. And also, I have already told you that once we grow, we love to keep pets. 2 pets are very common in the world. 1 pet, dogs in America and Europe, especially in America. They love a lot to dog. The reason is that dog is the only animal which can show its emotion, affection to you out of his or her body action. Taking round and shaking the tail and jumping on you. No any other animal can show that type of action of affection and love rather than dog. So that is the reason Americans, they love a lot and they take care of their dogs. So that pet allergy is also there. And in Japan, they love to keep pet cats, different type of cats, Japanese they love. And these both animals, they have the condition of allergy. In that case, only we have to go for management. We should separate their rooms and let them be given bath, and time to time you consult your veterinary doctor, and you should not mix a lot with them, because that pet allergy, sometimes you will not notice, you will not think about that. Watery and red eye. Watery and red eye is the first very important indication of any allergic condition. Your eye will become red and the water will start coming in the form of tear. And I am going to show that picture of watery eye and that, and sometimes you will be sneezing. That condition will come. So you can see here, this is watery eye, and the eye is red and is full of water, that is called tear. And this type of allergy is very common once the reaction starts. And first it will show in the eye. It can be by pollen, by eating something, or any type of reaction, and that is affecting first your eye is becoming red and watery. The other condition you might have seen here, one female is putting handkerchief on her nose. It is because of the running nose, sneezing nose, and this is very common type of allergic condition in adult. And the best remedy for this is, I am going to discuss, that is called saline water irrigation, nose irrigation, and go for some very specific nasal drop. It's very, very important to treat such type of condition. So here I am showing different type of tree nuts. And in that tree nut, in Indian language, I can say, you can see badam, akroot, and walnut, and some others that even I cannot recognize. But they are mentioned as they are responsible of oral allergy and as well as general allergic condition. Here, this is called nasal saline irrigation of nose. And it is going to cover your, two things. First, your nasal road will be clear, it will not be congested. And secondly, it is also known as sinus irrigation. Sinus means there are some pores near your nose and below your eye, and sometimes if they are congested and there is inflammation, that is called sinusitis. So it will reduce that condition. And the other condition, allergic condition, that is called genetic factor. That we cannot roll out, we cannot ignore. We have to face it. So once your parents, great-parents, great-grandparents, if you have family history. Allergic condition means over reactive or super sensitive to environment conditions or your surrounding. You should be ready to face that. And those parents, they should know their history. And nowadays we are educated, so at least for 1-2 generation, by sharing our grandparents' experience, we can understand that we belong to genetic defect and pre-programming for this condition. And now how the adults can manage. That is called management of allergic condition. First thing is that now, if we have lot of first condition in night, we may spend sleepless night because of the nose congestion, total blockage we call it in common term, and breathing is very difficult. Sometimes it is choking, a lot of problem is there. And in globally, the 2 type of nasal drops are available. One is based on antihistamine compounds, because generally nasal drop people, they may not know, that's why I am giving you the chemistry. And the second one is that is antihistamine, and third one is that is steroidal. So to me, if there is serious condition, chronic condition I call it, where always your nose is running and nose is blockage in the night, throat choking, dryness of the throat and lip, in that condition, you meet your ENT doctor. Definitely he will prescribe nasal drop first. So 3 conditions of nasal drop is there: antihistamine, and the other one is that is some different type of other synthetic drugs, and steroidal. So go for steroidal nasal drop. That is very safe and very effective. And there are a lot of, nowadays in this modern age, very, very good, fine steroidal nasal drops are there. Of course, they are a bit costly, and some of them are very costly. But if you can afford, please tell doctor that, sir, why not to go for steroidal nasal drop. But of course, once you are suggested, sometimes doctors may feel offended. Otherwise, they will give antihistamine nasal drop. That is one condition. Second condition of management of your allergic condition is go for vaccine injection. And vaccine is a very simple thing. And I discussed a lot in previous lecture that the same pathogen or antigen or any substance which is going to enter, what vaccine means, like you have A, B, C, like A, B and C. They are foreign molecules. So if you are suffering because of A, so that A is having cell nucleus with chromosome and protein layer. Just in vaccine, what they are doing, they are destroying, damaging the protein layer. So it is no more living. So they are dead cells. And those dead cells, they are injected to your body of the same type of protein with which you are reactive. And it will go and that antibody will recognize, and they will bind, and there will be protection. And the best remedy today I am discussing, because vaccine therapy is very, very advanced globally, except, take it gently, except in African countries. And it is because of myth. Lot of old tradition and old thinking, and not having confidence in advanced countries. that is killing them. Please come out of your myth and come out of your perception and wrong information. So I have already discussed all these factors of adulthood allergic condition, but here in a very simple way I have given these tips for common man to understand all these terms. Number one, some drug allergies fade with age. They disappear once you grow older. Among the things we often lose, we are age, like we lose our hair, we lose our height. Of course, with age, your height will be slightly reduced, and we lose our innocence. Childhood innocence is everybody will love, everybody will try to hug you. That we are going to lose. And then some friends we are going to lose, some will die, some will be crippled. So it's also loss of friends and loved ones. And there is one more loss with the age, that is departure of allergies when you reach the age of 50 to 70. By that time, lot of allergic allergens, they will surrender and there will be departure. Number two, protein in the tree nuts bind antibodies. That is why all dry nuts, what we are using, some people are allergic. I have already told you, some people means those who are showing, that is overreaction to such type of things is called allergic. And that is nuts, they bind the antibodies. The antibodies are such type of proteins, they are known as immunoglobulin E. And this immunoglobulin E is the protein of antibody, and it will bind with those protein, vegetable protein, which is present in the nut. And then drastically your immune system will show the reaction, and that reaction may come in the form of some allergic condition of inflammation, anywhere, swelling. It may be some inflammation inside your mouth, on your lip, in anywhere. And bind antibodies, IgE, by person's immune cells. This IgE, what we are seeing in our body at cellular level, T cells, WBC cells, so many fighting cells, they are all with this immunoglobulin protein E, and that is responsible of recognizing all pathogens, all type of we can say antigen, foreign bodies, and they will fight, and there will be reaction, that is called allergy by person's immune cells. Number three, immunoglobulin E. This protein plays very important role in the allergic inflammation. And this one, that is immunoglobulin protein, that is IgE, this is actually antibody. And this plays very important role to recognize, because this immunoglobulin E is just like policemen will recognize the criminal and will chase, will fight, and that will cause inflammation. Inflammation means swelling. The watery red eye, that is inflammation. Throat choking, throat blockage, that is because of inflammation. Lot of conditions of inflammation you will be facing once your immunoglobulin E, policeman in the form of protein internal inside your body, is fighting and pushing and pulling the incoming foreign body. Inflammation, commonly called antibodies, and is the protein molecules our immune system produce, and this is actually IgE, that is immunoglobulin E protein. Recognize the germs and pathogens. These germs and pathogens, commonly they call it antigen. One we have inside our body, forced to fight, that is called antibodies. Incoming pathogen, bacteria or cells, they are called antigen. So there will be fight between antibody and antigen. That will cause the inflammation. and that inflammation is called allergic condition, and fight them and try to destroy them. What is allergic rhinitis? So allergic rhinitis is nothing but red watery eye and a running nose. That is called allergic rhinitis. So I have given here some points, some tips how to manage your adulthood allergic condition. I have already discussed, but some very latest research findings I have already mentioned just in short form, in the form of summary. Number one, figure out allergens by allergic testing. First thing is that nowadays you have to go for testing. A lot of very sophisticated testings are there, not only skin and all those, even they can take your saliva, they do the culturing. After the culturing, they will test with different type of allergens. That is very competent or perfect test of allergens. So first you should go for figure out all the allergens, whether it is from dust, flower, mite, this is very common, this also spider web, that is called Makri ka jala in India, like that. And number two, optimize medication. You have to optimize. You have to go for some modern and today's research according to that, not with your myth. Your ENT doctor will advise nose spray. Preferably you go for steroidal nose sprays, because these steroidal compounds in that spray is very effective to bring down quickly your inflammation, because that reaction of your antibodies and antigen causes in all conditions inflammation in any part, and that inflammation should be reduced. And in that case, either antihistamine for children, and even in the beginning antihistamine is okay, but if it persists, it continues, if it becomes chronic, always you are getting rash eye, red eye, watering eye, sneezing nose, continuously suffering, discuss with your ENT doctor. And I am telling as a medicinal chemist, the best way is steroidal nasal spray, and also irrigation of your nose, that I have already showed you that in India it is very common. I don't remember something, some pot is there, they will just pump the water, it will go from this right side, it will come out from left side, there will be totally flush outing of the all mucus which are there causing congestion, but that is not the permanent solution. If your immune system is weak and you are suffering from nose blockage in the night, congestion, lot of inflammation is there, the only solution is go for steroidal nasal sprays. Steroidal nasal spray is very effective to control inflammation. Number three is the latest one, that is called sign up for allergy shots. Lot of senior consultants, those who have gone through some PhD work, post-graduation, even up to super specialization, postdoc, nowadays such type of skill is taught to them, is a type of, we can say, towards vaccination. So what they do, they take, once they will identify the allergen, they will take the same allergen, they will dilute it and they will inject it in your body. So once that foreign material has gone to your body, immediately that antibody will rush. Just like police, that oh, somebody has come. And they will recognize, and slowly they will be settling down with that, and you will develop the immune against such type of allergens. This is very latest type of treatment is going on, but this treatment is very, we can say very effective and for your whole life, but it takes time. If such type of shots are given, a first shot, second shot, third shot, maybe up, one is given today, the second one they may give after 2 months, third one they may give after 6 months, and fourth one they may give after 10 months. So it may take 1 to 2 years time. It's a long therapy, but it is, very, very effective and permanent type of treatment. So with this I will stop. Thank you very much for watching the lecture.